Hi everybody, my name is Capella and I am a former student of Layla's, and she asked me to send you all a video talking about my work. I'm a community health nurse. I work for Clackamas County in their primary care centers. I am on call, so I just cover the sick days and vacations for the nurses that work in the 4 different primary care clinics. I love my work. I do a lot of different things, and it can get really crazy some days because I balance phone calls with my own appointment schedule and then seeing patients that have just seen a provider and then need some extra time with the nurse. So some of the things that I do is after a patient sees a provider, they may need some extra education, for example, using their glucometer to check their blood sugar, or maybe dispensing some birth control supplies. And then I also keep my own schedule, so patients will come in for appointments with me. A lot of times it's, a birth control injection, the Depo-Provera shot, or we do a certain amount of testosterone injections for people with hypogonadism or who are transitioning genders or maintaining a different gender. So then I also have these things called standing orders, and what this means is if somebody comes in and says, I think I have a urinary tract infection, and so I go down my list and I make sure that they don't have any risk factors, say another kidney disease, or that they're over 65. Not being female is another risk factor. And if they have the consistent symptoms, I rule out that it's not actually a vaginal infection, and the urine dip is consistent, then I can actually send a script to the pharmacy so that they can get treated. This came in really handy. About a month ago, an older lady came in who had she apparently had a urinary tract infection, and it was just one of those funny days where there wasn't a provider in the building until 10 a.m. and I was able to get her out the door before 9 so she could get to the pharmacy and get some medication so she could get some relief from her infection. It feels good to be able to do that for people. We also have standing orders for the initial prescribing of a birth control method, and then they get 3 months to come in and have a full exam with the provider, and also to treat chlamydia and gonorrhea, since we want to get those taken care of right away. And generally a provider gets to them first, but or they've seen a provider and done the test and then the results come to us. But because we're linked to the county health department, we also get orders from the infectious disease nurses. So they'll fax over an order, and then we have to contact somebody and have them come in so that we can give them their treatment for, say, syphilis. That's not a fun treatment. It's 2 very big shots. People don't enjoy that. I also do a lot of phone calls. The providers often ask us to follow up on patients to see if they're monitoring their blood pressure and if it's doing better with a medication change, or their blood sugars, and we actually have the authority to do some insulin titration. So if their blood sugars are definitively not at goal, I can say, okay, now you can increase your insulin another 3 units, and then I'll check back and see if you're where you need to be. So it's really great because working in a center like this, it's a patient-centered primary care home. That's a whole statewide program for Medicaid clinics, and you can go to the Oregon Health Authority website and read more about them. But the idea is to have this multidisciplinary team so that patients don't just have to come see their doctor. They have nurses who are also able to do some case management, social workers, community health workers, who are really trying to make sure that we're proactive in caring for patients that need a little extra boost. So that's what I've got to say about working as a community health nurse. We have some home visit nurses who do the home visits during pregnancy and with newborns. That's a evidence-based intervention for preventing child abuse. We have the CD nurses who get to track down contacts of people who got STD, unfortunately, or even TB cases. And then we have those of us that are in the main center doing the patient care with the multidisciplinary team. It's been great talking. If you have further questions, you're free to contact me at crowfoot@ohsu.edu. That's CROWFOOT@ohsu.edu. Best of luck in your nursing journey.